After a surgical residency, I did a colorectal fellowship in Texas, which is a year of kind of intense training just in the specialty of colon and rectal surgery. That involves obviously not only colon resections but all the other operations for benign anal rectal pathology. Well, recently, at least over the past year to year and a half, I've been focusing on starting a program of laparoscopic colon resections. Now, laparoscopic colon resections have been done, but I've tried to make it my focus to try to make that a priority in colon resections here at Memorial. People have shown that, with smaller incisions and less invasive surgery, patients generally do better and can often get out of the hospital a day or two earlier. This often helps also with their overall recovery, and if patients get better quicker, it's less taxing on them from their family standpoint and work standpoint, and if you can get them back into society quicker after a large operation, everyone does benefit. We've had great results here with our single incision laparoscopic surgery. We've had great success with our laparoscopic colon resections, and I think that the time and the mindset of having to drive 2 hours away because the perception of better care, I think, is over. I believe the quality of care from ancillary services to especially the nursing services here at Memorial are comparable to any large university setting. I think that all these services do a very good job, and I think combined make an excellent resource for patients in the community. I think that the biggest fear for people to undergo screening is just the fear of the procedure itself. Now, I can say that this day and age, the concerns about sedation, the concerns about the procedure for screening are pretty much unfounded. Patients do very well, and I think it's very important that everyone gets screened at the appropriate age. If the data clearly shows that if you do the screening at the appropriate intervals and the appropriate time frame, the amount of cancers that are caught are clearly almost always in the curable stage. If you do wait and decide that fear might prevent us from doing this procedure, unfortunately these people are the ones who are caught at later stages that really sometimes aren't curable. Oh, I believe minimally invasive techniques are operations that are taking over all fields. Here at Memorial, a lot of my partners and other general surgeons here in the hospital are taking advantage of that minimally invasive approach, and I think that you'll continue to see evolution of this process until maybe in the future everything will be minimally invasive. In almost all situations, the idea of making smaller incisions and less invasive operation is always a possibility. Obviously, there are some technical and patient factors which sometimes prohibit the minimally invasive approach, but it's obviously something we think about whenever any patient comes in with a surgical problem. Now, the evolution of laparoscopic surgery continues as well, and what we've been recently doing here at Memorial is what's called SILS, or single incision laparoscopic surgery, which generally involves a very small incision where the entire operation can be performed through a 3 to 4 centimeter incision. Now, this is even less invasive than traditional laparoscopic surgery, and I believe that in the future this will be the benchmark by which all colon resections go. And so this is just one of the options you can discuss with me or other surgeons here at Memorial when it comes time for any larger abdominal operations. What we try to envision here at Memorial Medical Center is excellence for every patient, every time. And although those might sound simply like words, what we try to do is create an environment here which lives up to those words. An environment that not only tries to educate the patients as to their problems and how we can assist, but also focus on their fears and their anxieties and keep them educated so that they always know that despite where they are in their hospital course, there's a group of physicians, nurses, and other ancillary services who are always there to offer assistance in all of those categories. And I think from my time here at Memorial Medical Center, I believe that we've accomplished that. I believe that patients are now realizing that they don't have to drive to Pittsburgh and other outside facilities, and that this is an area and a hospital that can service all their medical needs.